to be affected by this to a great extent, this election. And I don't know how you can stress it anymore. Is going to be maybe not, well, you and I to some extent, but maybe to a greater extent, our children and our grandchildren, because they're going to feel the effects, the fallout of this election for many years, in my opinion, if Hillary Rodham Clinton gets elected president of the United States. It's that simple. And we're joined right now by Bob Moffit, who is a PhD. He's also the head of the Heritage Foundation Center for Health Policy Studies. We appreciate him being here with us. He's a senior fellow there with the Heritage Foundation Center for Health Policy Studies. Mr. Moffit, how are you?
I'm doing great, sir.
Do you prefer Dr. Moffit?
No, that's fine. Bob Moffat's just perfectly okay.
All right, Bob. Well, it's good. Thanks for joining us today.
Sure.
You know, I talked in my last segment with somebody from the Independent Women's Forum about the bigger problem with this Obamacare spiral, this death spiral, as some people are calling it. I know that younger people are going to be impacted by this as well, because right now they already face penalties if they don't get the coverage. And their premiums are going up 25, 35, 45, 50% and greater.
Yeah. This is not a friendly law for young people who want to get insurance or not either in employment-based health insurance or on their parents' plan. The thing is, the way this is working is that we're looking at a very, very big increase in premiums this year. I mean, as you know, the administration reported that nationwide the average would be 25%, which is the highest spike yet of all the past 4 years. Now, this again is an average. In many states, the premium hikes are going to be lower. California's lower, New Jersey's lower, New Hampshire's lower. But in other states like Arizona, the plan costs are frankly psychotic. They're crazy. And, I mean, they're really crazy. I think the benchmark plan in Arizona went up like almost 100% or something like that. It was just wild. There's another side of this, of course, and that is that it's not just the premiums, the cost of premiums. It's also the deductibles in the exchanges. And the deductibles have risen roughly 3 times as fast as the premiums in these exchanges since 2010. And if you look at it from the standpoint of the economic ability of people to actually function in this environment, it's about 7 times faster than the growth in wages or inflation. So, if you're a single person and you're relatively young and you make over $46,000 or $47,000 a year and you get no subsidy, you're looking at a tremendous health care cost. And a lot of those folks are simply not going to sign up.
No, they're not. And
no.
That's one reason this system is failing, because they're not getting young, healthy people involved, right?
No, and that is a very, very serious point. And frankly, to their credit, to some of Obamacare, even Obamacare's supporters, raised this red flag very, very, very early onward. David Cutler over at Harvard, who's been written a lot about this. Dave Cutler did say, that there's a real concern about this, and that concern, of course, the conservative analysts have been saying this since day one. That concern is now coming true.
Jeez. So I guess the question somebody called in here and asked earlier was, what if this thing goes to a single-payer system at some point, as I believe, and you may be uniquely qualified to comment on this, because when Hillary Clinton was pushing health care changes back in the early 90s, you were already at Heritage, and you were kind of analyzing what it was she wanted to do.
Oh, yeah.
I mean,
yeah,
healthcare...
I'm sorry, go ahead.
No, go ahead.
No, I said I got heavily involved in health policy at Heritage because of my initial critique of the Clinton health plan, frankly, I was rather proud of it because that bill was 1,342 pages, which, by the way, that's a little bill compared to the 2,700-page monstrosity, of Obamacare. But anyway, at the time, we did an analysis of it, and we didn't think that it was going to be successful, and we published that. And the Washington Post, was very fair, and they gave us a lot of press on that because we basically were the first major analysis of the Clinton health plan. The Heritage analysis was the first major analysis of the Clinton health plan. What's interesting about this, and your listeners have got to get this absolutely clear. What is interesting about Obamacare is that if you look at the key elements of it, right? The pillars of this monster. All of these elements are basically in the original Clinton health plan. The employer mandate, the individual mandate, the federal control over health insurance rules and regulations, the creation of a government regional, they called it regional alliances, they call them now exchanges. Basically
right.
The same type of thing, where basically these were very powerful regulatory agencies. The decision to use Medicare as a funding source to expand entitlement expenditures in the Clinton health plan. All of that was part of the original, Clinton health plan. So with Obama, we got the Clinton health plan.
Right.
By the way, now your question is, what about the public option or what about single payer? There's a real debate among, our colleagues up here about whether, in fact, this was intended all along. And you could understand people saying it was intended to be this way. But, it's not entirely clear that this was the intention. I think, my own view is, I think they really wanted to make this work. It's just that they put their faith in the managerial power of the federal government
as they always do,
basically calibrate all of these things. And that has turned out, the central planning that was required for this has turned out to be absolutely a failure. They simply can't regulate and plan a sector of the economy that is as complex as this. That's what I think happened. And that, as a result, what you're getting, actually, is they're creating, with the exchanges and the subsidies for low-income people, they are actually creating a two-tiered healthcare system in America. Those of us who are in private insurance through our employers, and the rest of the population, the lower-income population, who will basically be dependent on the government subsidies and the exchanges.
And I've got about
they're going to be in this one system. The upper middle class will be in private-based health insurance. Now, maybe their public option proposal is going to try to move us toward a single payer. I think that's the public option agenda.
Yep,
whether they can pull that off is another matter.
I agree. Bob Moffit with the Heritage Foundation, the Center for Health Policy Studies. Listen, thank you so much. I'll direct people to heritage.org to read more of your articles on this. Thank you.
Thank you very, very much. It's great talking with you.
Absolutely, and I appreciate his knowledge. He's the guy at Heritage who initially analyzed what Hillary Clinton, when she first tried to push this monstrosity in 1993. Wow. There's some history for you, and there's some perspective. All right, folks, stick around.